If you are over 60 and taking any prescription medication right now, stop and watch this before your next dose. I am Dr. Elliot Grant, cardiac surgeon with 25 years in the operating room. Today, I am exposing 5 medications that doctors routinely prescribe to seniors that I personally would never give to my own parents. Number 3 is something millions of seniors take every single morning, and it is silently destroying their heart. Let me begin with a story that still haunts me. A 68-year-old retired school teacher named Margaret came to my office 3 months ago. She was a vibrant woman who had raised 3 children, volunteered at her church, and loved gardening. But when I met her, she looked 10 years older. She told me, "Dr. Grant, I feel like I'm falling apart. I can't catch my breath walking up my own driveway. My ankles are so swollen I can't wear my shoes, and I'm so tired that I fall asleep in my chair by 7 p.m. Her family doctor had told her it was just normal aging. But Margaret knew something was wrong. She had mild diabetes, borderline high blood pressure, and occasional heartburn. Nothing dramatic. When I asked for her medication list, my stomach turned. She was taking 3 of the 5 drugs I will name today, within 6 weeks of carefully switching her to safer alternatives under close supervision. Her swelling disappeared. Her energy returned. She called my office crying tears of joy, saying, "I feel like I got my life back." Margaret is not a rare case. I see a Margaret every single week, sometimes 2 or 3. The tragedy is that most of this damage is completely preventable. These drugs are not illegal. They are not recalled. They are sitting in your medicine cabinet right now, prescribed by well-meaning doctors, but they are destroying your heart, your brain, and your independence. Today, I will name each one, explain exactly how it hurts you, and give you safer options to discuss with your doctor. Now, you might be thinking, Dr. Grant, if these drugs are so dangerous, why does my doctor keep giving them to me? That is a fair question. Let me give you 4 honest answers. First, most doctors mean well, but they are overwhelmed. A typical primary care physician sees 25 to 30 patients per day with only 10 to 15 minutes each. In that time, they have to review your chart, examine you, update records, and answer your questions. There is almost no time to research the latest studies on geriatric medication safety, so they rely on habits they learned in medical school 20 or 30 years ago. Second, pharmaceutical companies spend billions of dollars marketing to doctors, free lunches, sponsored speaking events, even paid consulting roles. Those lunches are not evil, but they create unconscious bias. A doctor who eats a free sandwich while listening to a drug rep talk about a new diabetes medication is more likely to prescribe that drug, even if an older, cheaper, safer option exists. Third, patients themselves demand pills when a senior comes in with back pain or trouble sleeping. They often say, "Doc, just give me something. I don't want to stretch. I don't want to change my diet. Give me a pill." It is easier for a tired doctor to write a prescription than to have a 20-minute conversation about physical therapy or sleep hygiene. Fourth, many of these drugs were approved by the FDA decades ago when we did not have good long-term studies in older adults. A drug that works fine for a 45-year-old can become toxic for a 75-year-old whose kidneys and liver process medications much more slowly. The guidelines are always 5 to 10 years behind the science, so I am not here to blame your doctor. I am here to give you the knowledge. To become your own advocate, write down these 5 drugs. Bring this video or my list to your next appointment. Ask questions. That is your right. Let us begin with drug number 5, which is the least dangerous on this list, but still something I avoid in anyone over 60. I am talking about NSAIDs, non-steroidal anti-inflammatory drugs. You know them as ibuprofen, Advil, Motrin, Aleve, and prescription-strength versions like diclofenac, meloxicam, and naproxen. Millions of seniors take these for arthritis, back pain, gout, or general aches and pains. Here is what happens inside your body. NSAIDs cause your kidneys to hold on to sodium and water. That increases your total blood volume. More blood means your heart has to work harder to pump it around your body. Over months and years, this leads to higher blood pressure, worsening heart failure, and fluid buildup in your lungs. I have operated on patients whose hearts were failing simply because they took ibuprofen every day for knee pain. NSAIDs also thin the protective lining of your stomach and intestines, which can cause slow, silent internal bleeding. That bleeding leads to anemia, low red blood cells, which makes you tired, short of breath, and dizzy. In seniors, this is a major cause of hospitalization. So what should you take instead for pain? For most seniors, acetaminophen Tylenol is safer for the heart as long as you do not exceed 3,000 milligrams per day. Even better, ask your doctor about topical NSAID creams like diclofenac gel or Voltaren gel. You rub it right on the sore joint and almost none of it enters your bloodstream. Physical therapy, gentle walking, and warm baths are also powerful, underused tools for pain. Drug number 4 is muscle relaxants. Common names include cyclobenzaprine Flexeril, methocarbamol Robaxin, coraceprod Alsoma, and tizanidine Anaflex. These are often prescribed for back spasms, neck pain, or fibromyalgia. Here is the danger that almost no doctor warns you about. Muscle relaxants do not just relax your back muscles. They relax every muscle in your body, including your diaphragm, which is your main breathing muscle, and the muscles in your throat that protect your airway. In seniors, this leads to shallow breathing at night, worse sleep apnea, and a greatly increased risk of aspiration pneumonia, that is, when you accidentally inhale food or saliva into your lungs. That type of pneumonia is a leading killer in older adults. Muscle relaxants also cause profound dizziness, confusion, and morning hangovers. I have personally treated 3 seniors in the last year who got up to use the bathroom at AM while on a muscle relaxant, fell, broke their hip, and never walked independently again. One of them died from complications after surgery. For acute back spasms, the safer alternatives are physical therapy, gentle stretching, heat packs, and magnesium glycinate supplements, which relax muscles naturally without sedating your brain. If you absolutely need a medication, a short course of acetaminophen or a low-dose benzodiazepine for no more than 3 days is sometimes used, but even that carries risks. In most cases, time and rest are your best medicines. Now we come to drug number 3. This is the one I warned you about in the opening, the one that millions of seniors take every single morning, believing it protects their health, while it silently destroys their heart. I am talking about sulfonylureas, a class of diabetes medications. The most common names are glyburide, also called glibenclamide, glipizide, and glimepiride. If you have type 2 diabetes, please pause this video right now and look at your pill bottles. If you see any of those names, I want you to pay very close attention. Sulfonylureas work by forcing your pancreas to release more insulin, regardless of what your blood sugar level is at that moment. Think of it like stomping on the gas pedal of a car even when you are already going 70 miles per hour. This causes blood sugar crashes, hypoglycemia. You may know the feeling: sudden sweating, shaking, confusion, hunger, and in severe cases, loss of consciousness or seizures. These crashes are dangerous enough on their own. But the heart damage is even worse. Sulfonylureas interfere with a process called ischemic preconditioning. That is a fancy way of saying they block your heart's natural ability to protect itself when it is not getting enough oxygen. In plain English, if you have a silent blockage in one of your coronary arteries, and many seniors do, without knowing it, and you take a sulfonylurea, your heart cannot adapt during exercise, stress, or emotion. You are far more likely to have a heart attack or die from a sudden cardiac event compared to diabetics on safer medications. Large studies show sulfonylureas increase cardiovascular death by 30 to 50%. When I switched Margaret from glipizide to a low dose of metformin plus diet changes, her blood sugars stabilized, her energy returned, and her heart function improved. If you are on a sulfonylurea, do not stop it suddenly. That can cause dangerously high blood sugar, but make an appointment with your doctor this week and ask, can I switch to metformin, an SGLT2 inhibitor like empagliflozin, or a GLP-1 agonist like liraglutide? Those newer drugs actually protect your heart and kidneys instead of harming them. Drug number 2 is Benzodiazepines. The brand names you may recognize are Xanax, Valium, Ativan, Klonopin, and Librium. These are prescribed for anxiety, panic attacks, insomnia, muscle spasms, and even alcohol withdrawal. I cannot tell you how many seniors I have operated on who broke a hip or suffered a traumatic brain injury from a fall caused by these drugs. Here is why: benzodiazepines slow down your central nervous system. They reduce reaction time, impair balance, and cause morning grogginess that lasts up to 18 hours after a single bedtime dose. A senior who takes Valium at PM will still be unsteady on their feet at PM the next day, but the long-term dangers are even worse. After just 4 weeks of daily use, your brain stops producing its own calming chemicals, a neurotransmitter called GABA. That means you become physically dependent. If you try to stop, you experience rebound anxiety, insomnia, panic attacks, seizures, and even delirium tremens, which can be fatal. Many seniors end up taking benzodiazepines for years simply because they cannot tolerate the withdrawal, and the dementia link is now proven by multiple large studies. Seniors who take benzodiazepines regularly for 3 months or longer have a 50 to 80% increased risk of developing Alzheimer's disease or other dementias. So what can you do instead for anxiety? The gold standard is therapy, specifically cognitive behavioral therapy, or CBT. It works better than pills with no side effects. For acute anxiety, a low dose of buspirone or ANSRI like sertraline Zoloft is safer, though these also take weeks to work. For insomnia, cognitive behavioral therapy for insomnia, or CBTI, has better long-term results than any sleeping pill. Melatonin at 0.5 to 1 mg taken 2 hours before bed is safe for most seniors, but start low and never drink alcohol while taking a benzodiazepine. That combination can stop your breathing. And now drug number 1, the medication I fear most in patients over 60, the one I would never ever let touch my own parents' medicine cabinet. It is first-generation antihistamines, specifically diphenhydramine. You know it as Benadryl, Nitol, Somanex, and in many combination products like Tylenol PM, Advil PM, and Aleve PM. Millions of seniors take this for allergies, hay fever, cold symptoms, or as a sleep aid. Here is the truth that will shock you. Diphenhydramine is a powerful anticholinergic drug. That means it blocks a key brain chemical called acetylcholine, which is essential for memory, learning, and muscle control in a 65-year-old brain. Blocking acetylcholine causes confusion, short-term memory loss, constipation, dry mouth, blurred vision, difficulty urinating, and falls. But the heart effect is what terrifies me as a cardiac surgeon. This drug prolongs the QT interval. That is the time it takes for your heart's lower chambers to recharge between beats. A prolonged QT interval can degenerate into a lethal arrhythmia called torsade de pointes, which is French for twisting of the points. I have stood in the operating room watching a patient's heart suddenly twist and stop beating effectively because of a single dose of Benadryl given for a mild rash before surgery. That patient survived only because we had a defibrillator ready. Studies show that seniors who take diphenhydramine regularly have a significantly higher risk of sudden cardiac death, and the dementia link is now ironclad. A landmark study from the University of Washington followed seniors for over 7 years and found that regular use of anticholinergic drugs like Benadryl for 3 years or more doubled the risk of developing Alzheimer's disease. Doubled. For allergies, the safe alternatives are second-generation antihistamines like loratadine Claritin, cetirizine Zyrtec, or fexofenadine Allegra. These do not cross into your brain. They work on allergies without sedating you or damaging your heart. For sleep, try magnesium threonate, a warm bath, a consistent bedtime, and avoiding screens before bed. Never ever take Tylenol PM or Advil PM unless a doctor has explicitly approved it after trying every other option, and even then, use it for no more than a few nights. I cannot say this strongly enough. Diphenhydramine has no place in the daily or weekly routine of anyone over 60. So let me summarize your safer options. For pain, use acetaminophen Tylenol at 3,000 mg or less per day, or topical diclofenac gel. For arthritis, consider physical therapy, swimming, or a cane to offload the joint. For back spasms, magnesium glycinate, heat, gentle stretching, and time. For diabetes, metformin is first line. SGLT2 inhibitors like empagliflozin and GLP-1 agonists like liraglutide are excellent but more expensive. Avoid sulfonylureas unless no other option works. For anxiety, therapy, deep breathing, buspirone, or Ansri under supervision. For insomnia, cognitive behavioral therapy. For insomnia, melatonin 0.5 to 1 mg, and good sleep hygiene. For allergies, loratadine, cetirizine, or fexofenadine. And for any medication you are unsure about, ask your doctor or pharmacist for a complete medication review. Many insurance plans cover a yearly brown bag review where you bring all your pills in a bag and a pharmacist goes through each one. Use that service. If you found this information helpful, I need you to take action right now. First, click the like button. It helps YouTube show this video to more seniors who desperately need to hear it. Second, subscribe to this channel and tap the notification bell so you never miss my weekly medication safety videos. Third, and most importantly, share this video with your friends, your siblings, your parents, and anyone you know over 60. Forward it in a text message, post it on Facebook, print out the list I gave you and hand it to someone at your senior center. You could save a life by sharing this message. I am Dr. Elliot Grant, cardiac surgeon with 25 years in the operating room. The best prescription is sometimes no prescription at all. Stay safe, ask questions, and I will see you in the next video.